It is time now for Morning Rounds with CBS News Chief Medical Correspondent Dr. Jon LaPook and CBS News contributor Dr. Narula. First up, the battle against Zika. As the number of cases continues to grow, techniques used to fight the spread are evolving, but not without controversy. Yesterday, for the first time, aerial spraying on the Miami Beach area used the mosquito insecticide Narula. And while it has been deemed safe, residents and Miami officials have some concerns. So it has been deemed safe. Why the new concerns, John?
Well, you can understand it, right? They're saying we're spraying something, it kills mosquitoes, and the natural question is going to be, well, what can it do to me, especially if I'm pregnant, okay? So I've spoken to the EPA, the Environmental Protection Agency, and the CDC, and they explained to me it's a matter of dosage. Yep. So at the low dosage that they're using, which, by the way, is like 2 tablespoons for the equivalent of a football field, it is neurotoxic to mosquitoes. It kills mosquitoes. But at that dosage, they're saying it's safe for humans. It's been used for more than 50 years. But of course, you can understand people's concern, and this is a classic thing of risk-benefit, and the public health officials are saying, look, the risk of the Zika virus outweighs the possible risk of the spraying.
But if you do have concerns, Tara, are there precautions you can take?
According to the EPA, there's no special precautions that people need to take. They don't need to leave the area while the spraying is occurring. But that being said, as a general principle, it's a good idea to avoid unnecessary exposure to pesticides or insecticides. And so one of the things you can do is when they are spraying, you want to stay indoors and close your windows. You also want to, if you are outside and get exposed to the spray, wash your skin or eyes with water. Bring into your house any pet toys or children's toys. Cover your grill, cover your furniture. If you have a garden with fruits or vegetables and you plan to use them, bring them inside and wash them. And if you're concerned that you have a reaction or are having a reaction, call your doctor, or you can call poison control.
It seems like the majority of the backlash, though, from residents at least, was the aerial spraying. Why do they have to do both aerial and ground? Why can't it be more targeted?
Because you remember the fact that these mosquitoes can breed a lot in just a little thimble of water. Well, think about what happens when it rains. And you have up in the tree, you have these little nooks and crannies. So the mosquitoes can be breeding up there, and you need to have the aerial spraying for that.
All right, moving on to a new finding about asthma. An estimated 24 million Americans currently suffer from the chronic lung disease, including nearly 7 million children. The independent journal Cochrane Review reports that there might be an effective weapon against it, one we all know about, vitamin D, often called the sunshine vitamin. Tara, tell us about this study.
So this study looked at this idea of something as simple as vitamin D, which is the vitamin that your skin makes when exposed to sunshine or that you ingest with food or supplements, could decrease asthma symptoms or decrease asthma exacerbations. They looked at 9 trials, a little over 1,000 children and adults who were given supplemental vitamin D, and they did in fact find that that would decrease the number of asthma exacerbations that required steroid treatment. It also decreased the numbers of people that visited the emergency room or were admitted to the hospital from 6% to 3%. There were no serious adverse events with the vitamin D. What they didn't find was that vitamin D did not decrease day-to-day asthma symptoms or change lung function.
We're sort of in the midway point then. So if you have asthma, take it or don't take it when it comes to vitamin D.
Well, the authors were very careful to point out in the discussion, this is preliminary data and it's relatively few people. And they specifically said there's really not very much information on kids. So I think for now, you heard about how you could get it naturally or how you could get it with supplements, with eating fish that's oily. I think it's time where you talk to your doctor about, maybe getting a vitamin D level, see where you go from there. But certainly, you should not change your regimen, your normal regimen for combating or preventing asthma based on this preliminary data. We need more research.
Finally, let's talk about food for college students. Some are just happy to have graduated from the high school cafeteria. Others, not so much. But times are changing, and so is campus cuisine. This week, Kent State University in Ohio announced it was opening an entirely gluten-free dining hall, the first of its kind on an American college campus. Boy, it's a long way from my college dining room, I'll tell you.
Well, this is right in your wheelhouse,
Right.
gastroenterologist.
I'm a gastroenterologist, and I applaud this. People may think, oh, that's overkill. But here's the thing. If you really have celiac, you can be very sensitive to a little bit of gluten. And there can be cross-contamination. So, for example, if you use a toaster and you put a regular piece of bread in it, you take that out, and then you put a gluten-free piece of bread. That can then get cross-contaminated if you have fried something that's fried, say French fries, which shouldn't have gluten in it, but it's being fried in something that previously had bread, fried chicken. That can be a real problem. So I applaud this.
Might be a new precedent, too. Drs. Jon LaPook and Narula, thank you both so much.